Okay, I'm going to call the meeting to order. We have a roll call. Laura Belsky's here. John Franco is excused. Keith Gray is here. Felix Garcia is here. Frederick Brookhouse is here. Aaron Carroll is here. John Morrissey. Addie Lenz is here. Melanie Jarzembowski is here. And I think that's all that we have for roll call. Do we have any citizens' comments this evening? Any citizens' comments? I'm not seeing any citizens present this evening, so citizens' comments are closed. Any supervisor comments?
Thank you for a fabulous dinner.
You're very welcome. Very welcome. Anybody else? Okay, chairman comments. What I'm going to do is we'll do the presentation. You all can ask questions. I'll go last and we'll approve each one separately. Okay, so let's start with the presentation of the 2024 budgets. We have District Attorney Gravely presenting for his last time before he retires.
Yes, and thank you for the opportunity. I've been told that brevity would be highly prized here and hopefully praised. So the only real changes that are discretionary changes in the VA's office budget is there's a $3,000 reduction in an item called temporary salaries. That's what we use to draft complaints that come in over the weekend. So it's essentially weekend drafting. We have at this point in time, we have a designated person that we pay to draft those complaints, who is a graduated lawyer. She was our law clerk last year, and so she is funded to draft complaints off hours and during the day. Any salary she gets is paid through that drafting. So that allows us to get in custodies done at a good period of time. We've asked for, or in this budget, have $3,000 less. I think it was $18,000 previously. Now it's $15,000. And then the only other place there's any change in terms of discretionary things is in an item called other professional category. There's a $20,000 increase, and that is essentially a budget reconciliation between the federal funds we get, which are called 4E grants. The federal funds are to fund our TPR prosecutor, that's termination of parental rights, and foster care prosecutor. So it's the same position, but it's a position where individuals who have not been able to care for their children for 2 years, even under direct court supervision, sometimes have a decision made by the courts and by our office to try to terminate their parental rights. That never happens without a permanent adoption home already ready. So we already have a placement for those children if we are doing TPRs in this county. That is the federal government money that comes in. Then we have to pay out to the state because that prosecutor is paid by the state. So there's federal money that comes in, and then the county through its budget process. So that's this line item pays the state. This year, we've identified that there has to be a reconciliation, and so the county recommended, this is the Department of Finance helping us, or the budget folks helping us, recommended that $20,000 more be in that line item this time, so that we were coming closer to what the state's estimate is on what we have to pay them to fund that prosecutor.
Is that 521,900?
So what the budget
Is that the other professional services?
Yes, it is. Yes, it is. So that's the only other increase in terms of anything that would be discretionary to us. Otherwise, all the items are provided to us in terms of salaries and insurance. Those are the only things I had to talk about. I'm happy to talk about sort of other big picture things, or talk about the savings I've partnered with this county board and being able to adopt over the years, if anybody wanted to hear that.
I do.
Sure. So 8 years ago, we came and proposed a change where we indicated that we were going to be in a situation where we had a designated officer from each of the departments come and testify at the first hearings, which are in the mornings. They're called preliminary hearings. Prior to that change, law enforcement agencies always had to subpoena officers who were often sleep deprived because a lot of the arrests are made at night, and they would have to come in the morning. And of course, law enforcement agencies had to pay overtime. After we made that change in partnership with the different agencies, we provided estimates to the county board back in those days that more than $125,000 countywide at the different law enforcement agencies were saved in overtime costs every year. So that's of course continued for all 8 years. In partnership with this county board, we went paperless about 8 years ago. We went from the dinosaur age where we had mountains and mountains of files, as law offices do all across the country. We had literally had huge file rooms full of files, and hours of every day were spent with our support staff searching for those files so we could prepare the lawyers for the next day. We had an enormous amount of paper costs, file costs, all the materials, ink costs, and all those things. We went paperless. It was a major effort in partnership with the IT department as well as the county board, and a lot of work with the state, and saved tens of thousands of dollars. I think in the first budget that we came in after we were paperless, we saved 25,000. We were able to identify more savings. So there's been tens of thousands of dollars of savings over the last 8 years in us doing that. And then we partnered with the county board and with the Department of Social Services to fund an additional position of a TPR prosecutor, a second TPR prosecutor that went on for 2 years. We were able to bring more than 60 children in this community who were in foster homes and would have been in foster homes for an additional, the county, the social services estimated it would have been an additional 18 months had we not had the additional resources. And because the county board funded those resources and that extra position, which now has been grandfathered out because we got that bubble of 60 additional children who were in foster care in this community through the system and managed to terminate their rights, get them adopted into their permanent homes. The estimate from the county social services department was we saved $250,000 for the county that year. And of course, that savings would continue because those children would not continue in foster care.
And it only cost us $25,000 a year.
It did, and social services and the judges and this county board were direct partners in that. I can't imagine there's been a more successful sort of small-term investment for long-term gains, not even mentioning 60 kids have permanent homes, which is of course way more, way more valuable than even the money that we're talking about. So those are three, prior initiatives so that were all partnerships with the county board where we saved a fortune. And obviously I'm here with really minor changes today.
Questions? Yes.
On the revenue, what is the IBE revenue?
So that's the Roman numeral 4. And that's that federal grant I just mentioned. So what we have is we have a prosecutor position, which does only TPRs and foster care process, which is the way that you transition to TPRs. That prosecutor is funded at about, it's either 40 or 20%, depending on what they're doing. Federal money funds that. Okay, and that then the county then contributes essentially a matching portion to that, and so that revenue is the federal revenue where they pay us for that position.
Any other questions? Done? Okay, do we have a motion to approve?
I would move to approve. Second.
Second? All those, youth and governance, how do you vote? Aye. Committee? Any nays? All right, your budget passes. Thank you very much.
Thank you.
Okay, next up, we have the juvenile court intake with Director Byer.
Thank you. I do have a handout. I think I might have some extras. We'll see. Are there extras? Maybe it's not.
Yeah, there's extras.
Yeah. Would you like?
You've gotten that way. Okay.
Okay, there's some right there. I'll come here. Now it's just not this I can. Oh. Thank you. Okay. Good evening, committee members. I believe we met all of you when I was here earlier this year to give an update on the department. If I missed someone that wasn't here previously, I'm Mary Byer. I'm the director of juvenile court intake. As you can see from the handout I just circulated, there are minimal modifications to my 2025 budget request. There are 4 line items total that I'm either requesting an increase or a decrease. Starting at the top with the personnel appropriation unit, I'm recommending an increase of $8,660, primarily due to the salary line increasing. In the other professional services account, which in my budget is responsible and covers all the costs for juvenile detention, we have been able to stay well under budget the last several years due to a decrease in usage, a decision to carry over available funds at the end of the year. In 2024, the line item was originally budgeted at $475,000 and then modified, adding a carryover from 2023. Through the first 9 months of this year, 2024, we have spent $273, which is less than half of the current available budget. Taking into account trends in utilization, daily rates remaining steady at the facilities we frequently use the most, and the availability of continued carryover again at the end of this year, the budget team and I are recommending a $125,000 decrease for 2025. The next line item that is affected is the public liability account, and that decrease is being recommended by the budget team. And last but not least, I'm requesting $700 to the furniture and fixtures account to replace a desk chair that is falling apart. That's all I have. Overall, I'm asking for a decrease of $117,000. Thank you.
Well, the taxpayers love you. Thank you for being so fiscally responsible. Any other questions? Yeah.
So where do we ever see that the carryover is happening, or is it just that the expenses are reduced? So the revenue that you're carrying over is already in your essentially
In that budget line.
that budget line item. So your expenses are actually going to be more than that, but they're covered by an offsetting amount. Is that, I understand it properly,
I
or?
believe that's what we're doing. I'm gonna defer to Barna.
So the expense will be not netted against the carryover. It just increases that expense budget line item. So let's use an example. So let's say there was 200,000 budgeted and 100,000 was carried over from the prior year. It bumps that budget up to 300,000.
Okay,
If an actual comes in at 250 and that 50,000 to carry over, then that 50 can be added to the next year's budget.
so are we gonna be seeing a budget increase come through the pipe this year, like last year? Is that what it is because you're actually not increasing the levy. So what you're trying to do is say, hey, keep the budget down, keep the levy down. We don't need to levy the money to cover that.
Right. In some instances, like this, it makes sense. Plus with the volatility of the.
Yeah.
Right. Normally,
Mhm.
we want the surpluses and deficits to kind of all wash out
Mhm.
and fill the bottom line, but in certain targeted areas like this, you want to use the carryover.
Okay, so the carryover, we'll see a budget amendment come through later this year then to account for the carryover then?
That will be during the carryover closeout resolution in April.
Okay, all right, thanks.
And I've been doing, just for your information, I've been doing carryover, I think the last 3 or 4 years. And there was a time many years ago where I would have to approach committees and ask for more money. So
Okay.
the ability to carry over has really been good.
Okay, thank you.
Any other questions? Thank you, Director Byer. Do we have a motion? We have a second? Supervisor Brookhouse? Youth and Governance, how do you vote? Committee?
Aye.
Any nay? Your budget passes.
Thank you.
Thank you.
And thank you for dinner.
You're welcome.
Should I sign?
Yes. Good evening, gentlemen.
Hi. You have a lot. Hey, Sharon.
Gentlemen, make sure to grab something to eat before you leave this evening. Yes, they are. Sheriff Brenner, thank you very
Yeah,
much.
thank you.
Oh, I'm good. Thank you.
Okay, you can begin whenever you'd like.
Good evening, ladies and gentlemen. Going to present the 2025 budget, for Sheriff's Office. Few highlights. I'll leave it before you get into your questions. We are at a tax levy of about 2.1% increase over the 24 adopted budget. And operating expenditures increasing about 2%, about 945,000. Our estimated revenue increase, 1.5%, or 159,000. So to accentuate operating expenses for 25. Personnel is a 1.4% increase. Deputy sheriff's wages, contractually going up. Wage guidance 3.75 increase on 12/29. That's when that goes up. Our current agreement takes us through 31st of 2025. We had one senior administrative assistant and we reclassified 3 positions. That cost increase is $3,455. Our contractual services, as I mentioned, increased. It's 4.3%. And the bulk of that's going to be NAF care contract. It's 206,000 of that. That includes offsite medical services, which we've discussed in the past. It's increased dramatically. Our other professional services increasing, aligns more with how we expect to end our 2024 budget of 45,000. Largest items being our WCS contract and shredding services. It surprised me. It's a big deal. Okay. We made cuts to the building, our equipment maintenance, electronic monitoring services, and some other contractual accounts. That's 43,000. And then supplies is about a 10% increase. It is $185,000. Our largest increase that's in pharmaceuticals, as we discussed. Our machinery equipment, which we discussed for the kitchen, some of the repairs, replacing some of that equipment, also dishes, bedding, things of that nature. Capital expenses overall increasing 7.3%. Excuse me, I'm sorry, decreasing. Thank you. That's much better. Decreasing 7.3%, about $124,000. And our motor vehicles. That's a $225,000 decrease for purchasing 13 squads. That includes the upfit cost. That's for 2025. Machinery and equipment. There's an increase. We have purchase of the dryer in the kitchen, which we were discussing just previously, and our detention center, and the next installment for our body camera contract. The revenue budget overall is a 1.5% increase, $139,000. We're estimating an increase in revenue from our federal limited housing. If that comes through the way we hope, I do know that the fees for the feds have gone up a bit. We have, that's the per diem rate also. The alien inmate housing, that's a SCAAP award. That's federal monies that come in. We discussed that quite a bit today. It's something I wasn't extremely familiar with. It's not common. It comes in sporadically, but that's money from the federal government. I'll reference any aliens that are charged with felony that are in our housing. They assist some of the costs. And then various Wisconsin Department of Justice drug enforcement grants. We have several, the anti-heroin, anti-meth grants, and that's where those are coming from. So we are estimating a decrease in revenue from the ARPA. As everyone here knows, the ARPA funds are down. They remain, they're down to the remaining funds, and the allocation is quite less than last year. Border prisoners in Huber, and then law enforcement, due to the fiscal year budget 24, budget assuming a third shift resource for Salem Lakes, which didn't end up happening. They decided not to go with that in their contract. So that those numbers are shown here, but they didn't materialize. Anyone have any questions? Yes, ma'am.
For the alien inmate housing, we're at, the actuals were 89,000 in 2023, and we only have projected 48,000. So how many does that equate to? How many people are we actually housing? You know?
I do not know.
Okay. I mean, because where do we get the 48,000? How do we,
It's based on the award.
it's based on what?
Based on an
Award?
award. It's not a formula that they do.
Okay. Okay, so we don't really know how many we actually have housed.
Right.
Okay,
This one is particularly sporadic. That's what I meant by that. It's hit or miss. We don't know what they're gonna
It
give us.
requires a lot of record keeping on the sheriff's department.
We have to supply a lot of data. And then we turn that in, and then behind the scenes, they're going through and determining based on the formulas that they utilize on what that amount will be.
okay.
So it can potentially vary.
And then the federal inmate housing, that was based on a census from the US Federal Marshals. I believe I wrote down 30 average annually. That's how you got to the 2 million. I think that's what was it?
They're at 30 now, and the projection is that for it to go back closer to where the past was.
Okay, so that's why we're at 2 million. Okay, and then, for the public liability insurance, that's gone up because of a study that was performed in 2023. That's correct?
Yes. That's where it's going to be.
Okay, and then other professional services. I'm just curious why we are down, why we forecasted down. Does it have to do with how we're reallocating invoices, or because we're projected at 248? That's line item 521900, other professional services.
You
It's
have
a-
revenues now?
I'm on, personnel, or I'm on contractual totals on the, under expenditures. And that would be 521900. So
Mine
the,
shows 229.
So does mine.
yeah, 229, yeah.
Which is up.
It's actually down. No, it should be up. It is up.
It's an increase.
Okay,
And it's just based on historical trends, how we've been coming in. And then that line also includes our, country funder, non-labor expenses that are flowing through their, shredding services, our WCS contract, but really, I believe we just increased that based on historical trends that we were seeing.
so that's outside of the 350 that we're projecting for Country Thunder. That's an additional
A
expense.
portion of those expenses hit here. It's primarily labor, is
Okay.
where we would see that, but there is a little bit of non-labor.
Okay. And then, the same block, 529,900 miscellaneous contractual services. Proposed, we only have 15,600.
That's correct. So with that one, we actually have, we expect a decrease in that line just because our, MAC COSAP grant comes to an end and, or actually came to an end last month.
Mhm.
And the expenses historically were hitting there.
Oh, okay,
So early it was 15.6 and that grant hit and we exhausted it. So we're ending with the same way we used to.
okay, that sounds good. And then, pharmaceuticals, could you go over that again? I know that you spent, quite a bit this past year.
So I don't know what to tell you, other than the costs are outrageous
Mhm.
and, the HIV, medications are very expensive. Some of these treatments are thousands at a time. So that coupled with, dialysis and things of that nature that we're putting the bill for that. So
Okay,
there was a lot of sending out of inmates as well. So it's been addressed, but meeting after meeting over it. That's where we're at this point.
okay. And then I'm gonna jump to revenues. And I'm gonna go to, 445, 8880 through 8885. When are the law enforcement contracts? Are they, annual contracts that we have with the villages?
That's correct.
And when do they expire? Fiscal end of year or
They're based on calendar year.
calendar?
They run January through December.
So will we be looking at these contracts again? In January, because I know that we had talked about doing some statistics. And looking at, are we allocating the,
Well, we're not, we've already,
already done,
we've already sent the contracts out because the villages are in their process right now, just like we are.
yeah,
So they have their contracts for 25 and they're working on them right now. So you know, we can always talk about the contracts, but when they renew, they're working on getting them approved by their village boards right now.
and can we revisit them at any time in that contract, do you know?
I doubt it, but I don't. We
Okay,
can always discuss them and prepare. It's always better to talk through it as opposed to surprise anyone with the
so
idea.
it would be a good idea then, once Captain Klinkhammer has his data together, that we actually do a deep dive on these contracts and take a look at, are we accurately projecting how many deputies we need in each village? And what is it costing, the county taxpayer to provide additional services that are not currently charged? And how does that impact our overtime? So I'd like to look at that in probably the second quarter of 2025 would be good.
Last week, I know that he discussed that here, exactly how that works. That's part of it, is to why we changed our call signs on the road, so we can get that data more accurately.
Right, because we want to be fair to the villages, but we also want to be fair to the county taxpayer too.
Sure.
And
Can I
then,
just follow up on that?
yes, absolutely.
So it looks like, if you went from the 24 budget to the 25, there's probably an automatic increase, like a 5% or 3%. Is that what's in these contracts? And they automatically renew each year and they have to come back for?
They come back for renewal. They come back to be redone, to be reconsidered
Every year. Okay.
Does it, I don't,
So these numbers are what then? Just,
The wage, so the personnel costs are based on the deputy's grade.
wages, got it?
Yeah. Wage.
Okay.
And the increase that's happening. at the
Is
end of
contract,
December
is what that is.
In those contracts. We also increased the, mileage cost for this squad card, because it wasn't where it should have been. And we increased that. All the villages except Salem Lake requested to stay status quo with their staffing. Salem Lakes is still considering that a full-time, year-round third shifter, or perhaps a half. And that may not happen at all, so,
in the past 5 years that I've been part of JLEC, I don't recall those contracts coming before the committee. Do they just go through corporate council? Do they get approved by the board? I just don't recall.
There's no need to bring them here, they just renew on that.
Okay, but I would officially like to review them second quarter. I think we need to take a deeper dive in looking at the services we're providing, because we're hearing from villages that they require more service than what's been contracted. So I want to make sure that we're playing fair with everyone. And then let's see, I think that's all I have. I know that probably when you go into finance, you're gonna be asked about the vehicles. So status of vehicles. Where are we at with orders? Are we on track? Are we backlogged on anything?
No, we're on track.
Okay.
Yeah, and it's, obviously it's our predecessor's, initiative, but the take-home squads, that's coming to fruition. I think we're in our last year of that. So we're gonna see some adjustments in the relatively near future.
And how about trade-ins? Trade-ins and getting new? Are we on track with cycling the squads in and out?
We are, well, like as we complete filling up the fleet with the take-home vehicles, that's when the trade-in will start.
Okay.
So the ones that we're trading in the very near future have, some of them have 280,000 miles on them. So the trading value is quite low on some of the vehicles, but yeah, that will start to come up as so it gets updated.
And then when we do have like crashed vehicles and such, do we use those vehicles for spare parts?
Typically, no. They get auctioned out, they get reclaimed county property and they get sent out to auction.
Okay,
Not that we couldn't do that, but if we.
no, I was just wondering.
Quick part to grab. But typically
Yeah.
no, that is.
Yeah, I was just wondering. Okay, and then I wish we had money that we could take from somewhere so you could get another data analyst, because I really think you need a data
So you
analyst.
said,
And I scoured through to try to find where I could take money from and move around, but I can't. I couldn't find anything. But I really think that that needs to be a priority for next year, is to have a second data analyst. Because we set ourselves up for failure with just one person. And then I talked to the county exec, and we'll look at some options for the dashboard for next year. So Chief Deputy, I'm still working on that dashboard, and we'll find a way to make it happen. I think it's a good thing.
I believe,
Any other questions for the sheriff?
Oh, go ahead.
You first. Okay, so on the revenue line for the federal inmate housing, it went up quite a bit over last year from $1,450,000 to $2,025,000. So that's a projection is what I think I heard based on some increases. Is if that increase or if that value doesn't come to fruition, do we have expenses that we incur anyway? Meaning like the revenue increased and we're claiming that, but do our expenses go up because of that, or do they go down if we don't get as much as we think?
well, they don't go up necessarily. The reality, and we've talked about this contract in the past, the reality is that we're gonna have staff working, irregardless, right? Irregardless, right? They're gonna be there. The reality is that if we don't, we're hoping for an increase because part of the reason that the numbers have come down, we think, we don't have all the answers, is that we're out of the contract, right? They didn't know if we were going to renew it, so our numbers are coming down, they were weaning us off a bit. We're hoping that it increases now that we've signed a good contract. So I don't know that, but will we be financially impacted? It just doesn't come up here. I don't believe we have expense in addition to, we're not gonna be moving as many inmates, we're not gonna have as many hours of overtime, because all of that's on overtime. You know, so we're still moving those inmates to and from, court here in the district, but.
I guess my simple question was that you're claiming an increase in revenue. Is there a like in kind increase in expenses that would trend the same if you didn't get that increase in revenue, that it wouldn't impact our expenses? I guess you know what I'm trying to explain it, that
I understand what you're saying.
it's a pretty big jump. And if it doesn't happen, are we at risk for not having
I don't
enough
think so.
cost? Okay, that's the basis of my question.
If you're asking me an actuarial study question and I don't have that answer.
It's not an actuarial, it's just like, hey, if we don't recognize those revenues, are we gonna be on the hook for additional expenses?
I don't believe so, sir.
Okay,
Sir.
Well, I think I was following up on his question. I think it's budgeting 2 million in revenue. If 1.5 million comes in, I think he's wondering, is there a $500,000 decrease somewhere in expenditures? And I think the answer was no, right?
right,
So you are gonna be in the whole $500,000,
right.
is the way I look at that, seriously. But
Yeah, that's maybe a better way of putting it. Thanks. Yeah, that's really what it is. I mean, because essentially by increasing the revenue,
You're looking for is the fair thing.
well, by increasing the revenue lines 500,000, you're decreasing your levy by 500,000, so your money isn't there. If you don't hit the 2 million, then.
Bottom line.
Right, yeah, go ahead, I'm finished. Thank you.
So if I listened correctly, and I think I did at the county board meeting, county exec indicated there was a social worker that was going to be assigned to your department. Is that not budgeted out of your
It's
budget?
not,
Okay, where's that budget out of?
human services, John Jansen, it's come out of his.
So just.
That person will be county employee, working through human services, and going to be placed with the sheriff's office to do that job with our on calls, sheriff's department calls, in our facility, et cetera.
Is that a in-facility thing, or is this a person that's gonna go out on the road? with
Both.
deputies?
Both.
So do we have any kind of hours this person's going to work? I think it's a great
It's not
program.
gonna be first shift. It's gonna be, and those hours are not yet set, and that's
Okay.
gonna be a collaborative work. So we have had a lot of talks about that, but it's gonna be kind of a hybrid, gonna be second shift going into some of the later hours, where the highest calls for chapter 51 calls for mental health calls are actually.
That's Carrie Foss's group.
It is, man.
And right now, there's just one full-time OB, whatever. Or,
Yes, sir.
okay. I think when you guys gave your presentation before, maybe I misunderstood this. Have you guys hired a mental health professional that deals with employees? So on the city, we have,
We talked
Mr.
about.
Harrod, who is there. Do you have that or you don't have that?
We don't.
Oh, you don't have it?
We don't have.
Okay, that's something that you were
Something we wanted. Yeah.
for,
Yes, sir.
to do that. So again, what do you, because, you know, maybe the data analyst is extremely important to you, but a mental health staff member would be more important to me, quite frankly, getting into your department. I think that's much needed, as those of you know from my previous career.
Yeah.
All the work I've done in suicide prevention and mental health for law enforcement, this is, to me, a high priority that should be there. What do you do now for the mental health of your employees?
We brought this up with the committee in the past. This year, we have tried to proactively, last year, we tried to do this and it's expensive.
Very.
And I didn't get across that bridge. It's okay. The reality is that, this year we had a couple of initiatives. We did, all of the Chief Deputy Miller. Assistant Chief, okay.
Yes, sir.
He'll probably interrupt me. The reality is that we have a couple of programs we're working in-house. We have, in addition to everything that the county does, provides more pressure on employees. We have a program that, it's an app and they can utilize it and they can call people and they can talk to people and, has all kinds of resources for them. And we were able to fund it in-house and it wasn't too expensive. And we have, I don't know the numbers, how many people have signed up to the app. It's a good number.
I think that's a Corrico app.
It is a
Dr.
Corrico app.
Dr. Black's app, correct? Right. I think it's a good app and I guess,
And we also do the smart dollar, which is the financial wellness piece.
right. And I know you said that was 56% or something like that. People use it. Again, I think the app is good. Looked at it, again, dealt with it many times, previous career, but it's nowhere near the same as having as an in-house mental health, person there. So, what are you doing training wise, to do this? Again, I know we pay $250,000 to the city for ours, so I know what the cost is. But again, this is extremely important to me, I think, and I presume it is
Well, I
to you. I know it is
appreciate it
clearly
because both
for, the chief deputy as well, and he does some training on this, quite frankly, that you do as well. So again, I don't want to bust anybody's budget, but if you have mentally healthy employees, then we save a lot in sick leave and other costs, so the work. I can't get probably 250,000 for
We actually
mental health,
discussed the
but is
number.
there,
He knows the number.
is there training that could help? Again, I don't know where I'm gonna find any money, but I think the purpose of this committee is to, if there is something, to at least send it to finance and they can look at it. So again, I don't know if there's a number you have or if there's training that you need. Do you guys do mental health days for each employee? So do you see any benefit in that? I mean, so on the city again, because we have a therapist, every officer gets a mental health day and they're required to go see the therapist. Now they can sit there for 8 hours and, you know, cross their fingers, or they can talk or whatever, but,
We don't have that.
I
But
think
here's the deal from, Chairman Gens told me that if we are adding anything to this budget, we are responsible for finding where we're gonna be taking it from and not relying upon finance to find the money. So if we are proposing any additions, we need to find where the subtraction is going to happen.
well, I guess I could hypothetically make up that this 2.7 million becomes 2.75 million. I mean, I think that's a terrible statement from the chairman of finance. I appreciate you passing it along, but,
Yeah,
again,
but we have to find the money to present it and not leave it up to finance to find the money for us, is what he's asking. So if we want to add to the budget, we need to find where we're gonna cut back. That was the instructions I was given.
Well, again,
Which leads to a question then. So I think the largest line item in your budget is salaries. So when looking at salaries, I assume that that's budgeted for a 100% fully staffed department, which you don't have a 100% fully staffed department. Maybe for a little bit of time right now is what we heard. Maybe we're only down one or something like that, or,
We
But
have 4
then-
retirements in January.
yes, right,
That gets moved to overtime though, whatever's not filled from a staffing perspective.
sure.
That overage covers the overtime expenses because we don't accurately forecast overtime.
Okay. Understand, but I guess, so then that's where my question is, do you, because we're understaffed, do you see carryover from that budget, or is that, or do you use that budget fully every year?
We use it. I guess I missed the question there.
The salaries, overtime, all the staffing budget, because, when you're talking about adding personnel or something like that, it really is directly related to staffing.
Sure.
And it also, to me, the mental health also has directly related to staffing as well. So I'm just wondering if that's where you would look for trying to fill a position or a part-time position, or because it's all about the well-being of the staff.
Yeah, unused salary funds, because we have empty positions. That's not something that we can realize and adjust. This finance.
so similar to, juvenile intake, there is no carryovers in your budget. Is that correct? All right,
But something like this shouldn't even be sheriff's department budget, right? That should be human services.
Not
If it's a-
necessarily
for
because
our
it's
staff.
it's part of staffing.
It's a direct trying to fit into our. See.
And Claire, maybe you can speak to that about,
I think.
If you had a mental health professional that was dedicated to the law enforcement staff and specialized for law enforcement support, I would recommend that it be in the sheriff's department.
And does human services have something like that already for county employees?
No, human services will provide mental health services
To employees? So there's nothing,
employee assistance program.
so I think that just highlights the issue in the whole county, not just the sheriff's department. That there's no mental health for anybody in the county.
Well,
We have a-
like I said, we have the employee assistance program that we provide to employees, and we have services through our health insurance.
You're a third party. And so that's through insurance.
To mental health providers.
So they can't just like go see somebody right away though. That it's not readily available to them. Like mental health professional, we'll see. They have to go to insurance on that.
well, sure. Yeah, they do.
Yeah.
Okay.
So
I
getting-
just think it's weird that, I mean, there's nothing like that readily available for them, but then. Yet an inmate in the jail has somebody readily available if they're going through it.
but you're talking about different departments, you.
I understand,
Yeah,
but it's all under the county.
it is, but there are separate, it's departmentalized,
I
yeah,
understand that.
yeah.
I understand.
So
Okay.
getting back to your point,
I would like to.
and I'm not saying, just to be clear, that my data analyst is more important than anybody's, well-being, because it's not. They're mutually exclusive. And I think that, both are important because one tells you the state of your environment. And the mental health professional, we've talked with, Chief Deputy, and it is very important, and he's tried to implement some practices. But I'm just saying, if there's a way for us to bring in a health professional, whether it's part-time to start out, to see how it goes. If we can find the money in here, we have a better chance of it getting approved before it goes to finance. So that's just, I want to clarify that.
Nope, understood and appreciate it. Don't necessarily agree in the analysis of which is.
That's fine.
But, I guess back to my question then, Sheriff, was, so again, I don't know that I can find 250,000 for an employee, but is there training that you think is available where maybe we can find some training funds to try and assist in maybe some more training? Because again, I would be very similar to the chairwoman. Next year, I think you should be coming forward with a mental health professional. So you want the data, maybe both, but I guess I'm asking, is there training that you're aware of out there that again, it's not a stat, but maybe that will help with this again. I think the app is great. I really do.
It is.
I think it works, but it's not the same as having training or being there. So again, just, that was really my question after,
Are you looking for a number?
well,
Expensive.
well, first off, is there training that you're aware of
I'll ask you.
that we could do and possibly what you think that cost would be? You know, I think the mental health days, again, I don't know what that cost would be if you gave everybody a day off just for mental health. And I think that's extremely important too. I wouldn't just want somebody having a vacation day. I don't like that concept of it, but, you know, I think a mental health day to actually do this, if they want to go talk to somebody, is extremely important.
Or after a day after a really serious call.
Right,
The terrible health service.
absolutely. You know, and the EAP is fine, they're great, but I'm gonna tell you, for somebody who spent 33 years in law enforcement, most cops don't use the EAPs, they just don't. There's a lack of trust, and good, bad, indifferent, whether it's right, wrong, or indifferent, is just a fact of life. But, so I guess my question is, to whoever, is there training that if we can find funding for, that would help perhaps in this realm of mental health for the deputies and the corrections and all of it? I mean, you got 360 some employees, I think, they're total, so it's not.
So what happened with how the app became a priority was that we originally in 2023 for the 24 budget had formulated the mental health day with, a current provider to have those mental health days. That was in heading into 24, $78,000. So I would, that, you know, my funny math, you know, I just had to say, well, that's probably about a $90,000 cost now. Right? And to answer your question about training, there's a lot of training, and you know, KPD has their peer support team stood up. It's cutting edge. It's one of the best in the nation. We're behind them, and it's going to cost, like Mr. Morris said, you know, that position is so important to you. Mental health is important. You know, the departments in the area now are going to 2 a day or 2 a year. You know, so we're already behind, right? And unfortunately, what's going to happen is something that is going to create chaos or catastrophe in our organization, like what happened with KPD, that puts our foot on the gas, and that's when we decide that this is going to be the right time, right? So, and that's going to be too late. So there is a lot of training out there. However, you can see in our budget, our staff development is, which our training budget is, got cut again for the second year in a row. $150,000 is what we built it up to 2 years ago. It's not enough to train a 400 person part.
Why did it get cut? Who cut it?
It's part of the cut. It's part of those adjustments when it comes back, right? We're at the bottom of the staff development line. I mean, Pleasant Prairie staff development number with a 40 officer department is larger than ours. So go ahead.
Oh, I'm glad. You finish. I just have a question about when you're done.
So to stand up so we have a peer support team, get them all trained like in the proper format, and to make sure that we have critical stress debriefers. You know, so when we have critical incidents, we have people that can come in and speak with our people. That's what that third party that Mr. Morrissey's talking about. We had a chaplain that did our critical incident stress debriefs. He's no longer with us, right? Those things cost money. Those folks cost and offer that service to us. So that person over in KP is who does the critical incident stress debrief. So all of that, you know, holistically is a large cost. It really is. I mean, we understand budgets. I've been doing for, you know, here at the Sheriff's Department for going on my 9th year. I understand that, you know, every year is lean. but it's gonna, like I said, it's gonna take one of those moments where we're too late and that's unfortunate.
Is there anything in here though that we could decrease to increase a position?
Our budget, our levy increase this year is the lowest it's ever been in the 9 years that I've been sitting in this chair. I mean, what else can we decrease? We already talked about the federal inmates funds, all those, the revenue sources are not.
There's no grants out there or anything?
We're not in
we can
the
use?
business of making money with the shit, you know. so-
No, I understand that.
There isn't. We've applied for all the grants. We've been denied for all of the mental health grants that we've applied for. There's not a lot of money out there for those type of things, which is ironic because it's hot button topic within our profession.
Mhm.
But Mr. Morrison's right, EAP is great, and I think it's great that we have EAP, and we do have officers that use it, but in the app, so it's layers, right? I mean, the app is a layer, you know, certain generations love the app, and, you know, it's very robust, but, you know, you have to make sure that you're able to effectuate change at every single level, and
But it doesn't take the place of talking one-on-one with somebody.
100%. And ultimately, there's opportunity to do that on the app. There's all the peer support people are in there, so it's just a touch and they call them, right? There's crisis lines. There's a lot of things. Again, I'm not like Ms. Morris said, it's a great app. It's one of the best that's available in the world, but it doesn't take that place of that embedded person within our department that is in an office that somebody can just walk in and speak to. That's a third party. They're not a cop. They're not tied to, and no offense to HR, but they're not tied to HR, right? They're independent, and KPD, again, they have the model, right? That person, it's completely secret, right? It's confidential. Those conversations that are had with command staff are, yes, people are using the service, not what are they talking about.
How much is the program in the city?
The, mental health,
Mhm.
250,000.
250,000? Barna, if we had to find 250,000, could we? We've got to be able to find it in this budget somewhere.
Sure.
Yes,
How much
in
is
the
the app?
sheriff's department.
Is it annual?
Wait a minute.
The average $10,000.
As chief deputy stated, there's a 2% increase from their budget for this year.
Why is it only 2%?
Based on the increased revenues that we're projecting and the increases having to do with the expenses that have shadow trying to mitigate those increases.
So if we were to do an analysis on some of our contractual services that we have midpoint next year, and we say now the revenue's bumped up, we can allocate that money how we see fit.
Yeah. I'll think we will talk about it. I'm sure.
You never know. Go ahead.
So again, finding that kind of money, and I don't know who they get to do it. I guess before I make a motion here, is there, and I don't know who to direct this to, is there either the opioid funds or other funds that can be used to fund the mental health stuff?
Opioids is specifically for opioids though, and because we had to be real careful with the court as well for Judge Wilk, that it would only provide those additional positions for opioid inmates. So that
Well,
was,
Schedule E is a little more broad than that, actually,
yeah,
because I don't know what county it was, and Chief Deputy Moore might be able to add the county, but we know that one of the counties utilized opioid, we watch what they do with that money. Try to figure it out. And one of them utilized their funds for first responders that have been responding to these. I mean, some of these deputies
Okay.
have saved the same person 5 times, I mean, and they're taking that home with them, and they've been to a lot.
is that something you
of
can
those.
look into then?
Sure, we could probably have that answer tomorrow morning.
There are companies
Chief?
that are using that. It is within.
Good schedule.
Sure. quoted the correct portion of it scheduled to me. Adams County is the one that he's speaking of. Um, So it is available within the opioid settlement fund, whatever the,
So you'd have to go back to that committee, correct?
Yes,
To request that money?
yes, ma'am. If we were going.
So I would say that you should put that option on the table then. To take it to that committee and to see if you can get the funds and then we can come and approve it.
the issue with that is, so you take those funds out at one time, it's something that has to be sustained. It's $250,000 a year
Right,
plus, right? Plus,
but I'm thinking of some of the revenues and maybe we look at some other things next year. So that, we can make that happen. Go ahead.
So again, I think it's a great discussion. I think it's extremely important. If that fund could be used, that'd be great. I mean, clearly it'd be an ongoing cost, which becomes a bigger issue, but, so I'm more next year here so we can get something going. But you told me I had to find the revenue. So we were told earlier that the federal inmate housing was a guess based on that. And if we don't meet it, then it comes off the general revenue. So I'm gonna make a motion that we increase the revenue to $2,115,000. And we increase the staff development by 90,000. So each one would be increased by 90,000 if I did my math correct.
And Varna, are you good with that?
We should have a second before anybody's good with it.
Is the county boards responsible with you, to make those recommendations?
Okay, there's a motion on the floor.
I'll second it to discuss it.
Okay, second. Discussion, I know that Supervisor Robinson, you had a question or comment?
All right, I'll try to tangentially get this to the motion. If we were able through this motion to increase the funds, do either of you think that having a mental health person on staff and additional training, would that decrease some of the turnover that we're seeing and possibly help to maintain our staffing levels at the level that we needed to stay so that we're not paying so much in overtime?
I would defer to Mr. Morrissey because he may have seen trends within KPD. I don't know that.
I can just speak again, both at KPD, we've certainly seen that, and, for the first time, we're gonna be fully staffed here shortly, and things are going well. But I will tell you from my work in suicide prevention of law enforcement on the nation level, that has made significant differences in many of the departments when they actually have that mental health provider. Not only does this mental health provider respond to the crisis they're there, it's the mental health days where the officers have to go check in. It's also this mental health provider, clearly ours, provides all kinds of training during the year to the staff as well. But she goes out and rides with these officers. Anytime there's a major incident, she's brought in. So, again, that's a lot of work for her. It's her passion. We stole her from the Milwaukee Fire Department. But, you know, it's, I think nationwide, you see the statistics that yes, having an in-house mental health provider, and again, she is a mental health provider, so she can provide, services, has decreased sick leave. It's increased productivity, and quite frankly, where it really is, it's the retention of officers, but it's the recruitment. People will say, you have, similar to what the chief deputy said, KPD has probably, and I'm certainly biased because I was part of starting it, the best peer support team in the state. In fact, our team trains a lot in the state. So when people get hired, and the chief was just talking about this the other day, they say, we know you have a mental health coordinator and we know you have a peer support team. So those are important things for the recruitment along with the retention. So, again, I know you'd asked that directly to the sheriff's department, but my research clearly shows that that has helped in all of those areas. So
Is 90, go ahead.
Well, I was just gonna say, so, I mean, everybody knows my bias is for something like this, it's a right cycling it, but, it's one of those things that, I'm trying to show that it's not just the dollars, it's dollars that we can be taking, you know, obviously the mental health of everybody is super important. Suicide prevention, all these things, but we can be looking at the fact that we would have less money spent in training our new officers if we can retain. We aren't gonna be paying as much in overtime. We're gonna probably be able to maintain staff longer instead of burnout occurring. I mean, there are a whole lot of things that we can be looking at with longevity of our force. And I just think it's one of those things that, you know, again, I love apps. Apps are great, but we really need a person. So how we find that money for that person.
My concern is 90,000 gonna be enough.
I only used the 90,000 based on the chief deputy, and that's what training they would get to be able to do some training. This doesn't get us
The health
but
professional.
if you can get the training in this year, again, he can go back, sorry, the sheriff can go back and get the money from the opioid fund, and that's there. But again, then it becomes to Barn and the county exec on an ongoing basis, which, you know, again, quite frankly, I think it's an expense that as a county, we need to do. You know, we've offered our assistance from the cities, but there's no way she could take on doing both departments. I mean, you know, it's tough enough, 222 swarms, so. We could steal it from you. Would have a problem, but yes.
So I just want to be sure. So you want to take the money from 445,801 federal inmate housing, lower it from,
No, I want to
you want to
add 90,000 there.
add 90,000 to 2,115,000
Yep.
revenue.
And then I want to add the 90,000 expense. What's the cost? To the,
It's 445,801, and then it'll go
staff
to,
development.
Right.
543.
That's what they're under on.
Which is
right?
Which is right. And then he wants to increase.
Is that for
the
training?
That makes sense, right? What I said.
I just want to make
Oh,
sure,
mental health thing.
You want it for the mental health.
Sorry, that's
It needs
right.
to go
The
to-
90,000 was for the mental health.
A different line than staff development.
But.
Is it gonna go to other
90,000
profession-
For mental health, that you said, not for training, right?
wait a minute. So is it going to go to other professional services then?
No, it should, you're gonna have to, you know, budget line. It's gonna have to be, right?
Barna?
What is the cost of the?
Well, the cost, like I said, was 78,000 in 23 going into 24's budget.
That's what someone that they're going to see as part of
That's
this.
what Dr. Child, Ashley helped us with it.
So that's the, or his,
Well, that was the cost of their day plus his fee for them to be there for 15 minutes, right? So,
I just want to know what account it's going to, so it's clear for finance.
To me, it sounds like you're more appropriate to be.
That's what I thought too. So it'll go to account 521,900. So that will be increased by 90,000. So there's a motion and a second that will increase revenues on line 445,801 to 2,115,000. And then for expenses, we will at 521,900. Professional services increase the 229,500 by 90,000.
219,500 or 319,000.
319,500. Increase it by 90. Okay. Is there more discussion on this topic?
Better find some federal inmates, Sheriff.
Thank you.
So, youth and governance, how do you vote? Committee?
Aye.
Aye. Any opposed? Motion carries. Okay, any other topics?
Oh, that's it. I had on this.
Any other topics for the sheriff? Sabrina?
Oh,
Or
Sarah.
Supervisor?
But-
Sarah, sorry.
Sorry. And this is really for anybody who can answer. What kind of flow factor do we have built in to the salaries in our budget? Do we have a flow factor built in?
you're referring to vacancy.
Yeah,
There is a portion of the salaries that is reduced for vacancy. But there's also a chunk that's left to offset all the big overtime.
okay, so what is that factor?
It depends on by division.
Okay,
There's. Trying to think, I believe it's more for the corrections because there's some turnover there, less so for deputies and detectives, there's less turnover. So it's based on the type of staff they have.
is there any way you could send us that flow factor so we can kind of take a look and say, okay, here's one for estimating for flow? I mean, I think that's kind of a varied number that's worth looking at.
Anything else? My apologies, Supervisor Curry. Anything else?
I would move to approve the sheriff's budget as amended.
Okay. There's a
Second.
second. Youth and Governance
Aye.
Committee.
Aye.
Aye.
Any nays? Budget passes.
Thank you, everyone.
Thank you. I think that's all we have. Except, motion to adjourn.
Motion to so moved.
Second.
All in favor?
Aye.
Aye.